Rebecca.
And I'm Courtney, and we're doing our presentation on human trafficking. We're going to begin our presentation with the Marissa project. We have a short video for you to watch. It's just going to introduce you to human trafficking and how it's affecting Michigan.
You just take a seat. Thank you so much for coming in. I'm Mary, by the way.
Mary, it's nice
to meet you. Don't mind the giant microphone above your head. Sure. There are 3 photos in front of you. If you could just pick one, it doesn't really matter which one it is, and show that one to us.
All right.
Could you describe her to us?
She looks youthful. I feel like this is one of those situations where if I say he's 23, then he's actually going to be 16.
Hispanic, maybe not full apart. Similar to me, actually.
Well, I mean, she's young, so probably has a lot of things to look forward to.
I would describe him as friendly.
She looks, happy. She doesn't look shy, but confident.
Anything she puts her mind to, she could achieve.
We actually have his story, so you could read that out loud to us.
Okay. Marcus. I grew up really close to my parents.
Adriana. I grew up with my brother and sister.
Amy. I remember watching the Olympics on TV when I was 5 and being totally in awe of the sprinters.
I was the middle child and easily the quietest.
I felt like no one ever saw me or cared.
Dad was too drunk to keep a job, and he never even saw me unless I was in his way.
Mom worked 2 jobs to make sure we had food for every meal, so she was never here to know when he would hit us.
One day when I went to the mall, like I like to do to be out of the house, a man came up to me and told me I was beautiful and asked me on a date.
On our first date, he drove me around in his car and said we could eat whatever I wanted.
Every time we were together, he bought me something new.
Tom really cared about me, and Tom really made me feel special.
I was in love with him.
After only going out for 3 weeks, Tom offered me a way out of my home, asked me to move in with him.
So when he asked me to have sex with him, I did.
He would put his hand over my face until I couldn't breathe.
Tom had friends over pretty regularly, and I could tell that some of his friends were into me.
So I kept my door locked and hoped that no one would bother me.
After a few nights of crashing there, he said that I still owed him for letting me stay at his place.
He said he had a friend who wanted to spend an hour with me.
He told me I might have to do some stuff, but not to worry about it. It's not a big deal.
When I didn't want to, he slapped me and said no one ever cared about me like he did.
But I didn't know what else to do because I needed a place to stay.
His friends forced themselves on me and took turns while he watched.
One by one, they'd come down to the basement, telling me how pretty I am.
When they're on top of me, I just close my eyes and pretend I'm running.
I'm exhausted and I don't know what to do.
My name is Adriana, I'm 16 years old.
My name is Marcus, I'm 14 years old.
My name is Amy, I'm 12 years old.
I live in Grand Rapids, Michigan.
And I live in Grand Rapids, Michigan.
And I live in Grand Rapids, Michigan.
That was very different than what I thought.
Especially because, like, being a girl and imagining, like, if that was me, like, that's, I don't even know, I can't even imagine what that would be like. She deserves to be a kid, just like what she is in this picture.
It being so close to home is something that makes me want to jump out of this chair.
I wouldn't think that Grand Rapids is a place where anything like this would ever happen.
Because you don't want it to happen to anybody, and you really don't want it to happen to people that live where you live.
Thank you for sharing her story with us. I'd like to show you something if you wouldn't mind taking her picture and following me to the gym.
expected something certainly a lot smaller.
Bar graphs and numbers, but these are actual people.
I don't know, in like my world, in my bubble or whatever, we like talk about this, it's not something we think about.
You know, what we see is only on the surface.
I mean, looking at this, sex trafficking doesn't have any discrimination, that's for sure. Ages, genders, can affect anybody. It hits you right in your heart, your gut, your stomach. It's like, wow. Now it's like I feel like I have this weight of responsibility to see how I can help.
Changes through greater awareness and making people realize that this does happen here and will continue to happen until we decide to make a stop.
So I'm assuming you probably either have chills, you're crying, or you are just completely dumbfounded by the fact that this is happening 2 hours away from where we are right now. This is why we are doing this presentation, because we want to educate you in regards to human trafficking so you know the signs and symptoms of it and how to help.
What is human trafficking? Human trafficking is modern-day slavery. Traffickers use force, fraud, or coercion as means to control over our victims. Victims are used for the purpose of engaging in commercial sex acts or labor services against one's will. There are two different types of human trafficking: sex trafficking and labor trafficking. Sex trafficking is defined as the recruitment, harboring, transportation, provision, obtaining, patronizing, or soliciting of a person for the purpose of a commercial sex act, in which the commercial sex act is induced for force, fraud, or coercion, or in which the person induced to perform such an act has not attained 18 years of age. Labor trafficking is defined as the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion for the purposes of subjection to involuntary servitude, peonage, debt bondage, or slavery.
This is a quote from the International Labor Organization. It pretty much states that there's almost 21 million people that are being human trafficked. That's only the reported people that are trafficked, so I'm assuming the number is much, much bigger than that. It kind of goes into that the majority of the trafficking is labor trafficking, actually, and then there's another portion of sex trafficking. Like I said before, the sex trafficking in the overall number has to be much more than what this reported stat is, but this is from 2016, so this is current.
The National Human Trafficking Resource Center has come with an action mean purpose model, and this is used to describe the elements actually involved in human trafficking. The first one is action, which is recruiting, harboring, transporting, providing or obtaining of an individual, patronizing, soliciting, and advertising an individual. Means is force, physical abuse or assault, sexual abuse or assault, confinement. Fraud, which is false promises of work or living confinement, withholding promised wages, contract fraud, or coercion, threats of harm to the self or others, debt bondage, psychological manipulation, or document confiscation. And purpose, either of compelled labor or services, or commercial sex acts. Why trafficking exists? Much similar to the drug and arms trafficking, it is a market-driven industry based on supply and demand. It is fueled by a demand for cheap labor, services, and for commercial sex.
Human trafficking is a low-risk business. Traffickers perceive there is to be little or no risk to deteriorate, to stop their operations. They believe that high profit margin will be worth the risk. They have lack of government and law enforcement training, low community awareness, ineffective or unused laws, lack of law enforcement investigation, scarce resources for victims' recovery, and social blaming of the victims. It is a high-profit business. Commercial sex creates a market and makes it profitable for traffickers and sexually exploited children and adults. consumers who are willing to buy goods and services from industries that rely on horses, labor. It creates a profit incentive for traffickers to maximize revenues with little production cost. Who's at risk? Anyone's at risk, internationally or domestically. There's social and environmental risk factors, lack of education, poverty, any place where there's a rapid increase in population, high-scale sporting events like the Super Bowl, a government lacking support of human rights, and then personal factors. It could be runaway children, foster children. They could already have a history of sexual abuse, debt bondage. If they owe somebody a lot of money, they feel this is the only way they can repay their debt, and undocumented citizens. They're easily, I think undocumented citizens are probably their easiest targets because there's no documentation that they're even here, so.
Okay, as we're all professionals in the nursing field, some in the NP program, and some in the master's program, forensic nursing, human trafficking is really prevalent in the emergency room. Identifying these patients in healthcare settings is crucial to, taking accurate record of how many there are and getting them the help they need. A couple of studies that were done, the emergency department is the front line of where these people are going to come and where they're going to come for treatment. They're going to come in and out throughout different cities just for 1 or 2 times treatment. They're not going to go to the same emergency room. So we have to kind of be very aware of who we're treating, what kinds of things we're treating. A couple of studies, up to 85% of victims have used the emergency room when they were trafficked. And that's, so most of those people, like I said, if they're going to seek health care, it's going to be in the emergency room. And in one study of ER clinicians, ER physicians that were sampled, only 4.8% of them felt confident in their ability to identify trafficking victims, felt confident in the signs and symptoms. So they often go undetected, and it's up to us as healthcare professionals to improve our detection and start to recognize these people. Some signs of a trafficking victim, again, it's not everyone who presents with these symptoms or signs is going to be a trafficking victim, but some signs are going to be concerns with domestic violence. They present very similar to a domestic violence patient. They're going to present with a controlling individual, a very strong individual with them who sometimes won't let them speak for themselves, who controls all their money or their insurance cards if they have insurance cards, someone who refuses to leave the room. They're not going to leave the room to triage them. They're not going to leave the room to let you assess them. They're going to be by their side the entire time. You're going to have a delayed presentation of illness or treatment for things that you can tell have been delayed. So they're coming in for an STD or an infection or an injury that happened a while ago, but they're just not presenting. They're never in control of their own identification or their own funds. It's always someone else handing over the passport or the ID. No insurance. Most trafficking victims are cash only. I know a lot of people don't have insurance, but that is kind of a trigger for a trafficking victim. And their story doesn't match their illness. What happened doesn't completely match their injuries or what you're seeing in them, which is also not unlike a domestic violence patient. And also they're going to have a lot of occupational complaints. So the victims in sex trafficking are going to have a lot of STD type complaints. Those in labor trafficking, if they're in a plant, they're going to have chemical exposure complaints, complaints related to their trafficking. So some problems encountered when you see them in the emergency room or a clinic or anywhere else within healthcare systems. It's going to be hard to obtain an accurate history. Again, because they may not know their complete history, they've been moved around a lot, or someone else is in the room who is speaking for them. It's also hard to complete a thorough exam because they're very nervous, very jumpy, and again, if there's someone who's trying to hide something, trying to hide a tattoo or a branding, some kind of mark on them, then they're going to make it very hard to do a complete head-to-toe exam. Also getting follow-up. It's, most of them are in and out of emergency departments, different emergency departments, so getting them to comply with any follow-up or, follow through with anything is very difficult. They have fear that it'll bring harm to themselves. If they disclose to healthcare workers or shame to their families, some of them left their families who were very poor. They left, in sex trafficking to try and make money, and their fear of returning to their families over shame. Their fear of law enforcement, or they'll go to jail, especially with people brought in from other countries. Their fear of being deported back to a situation that was originally worse. Those are the big concerns for why they don't want to report, why they don't want to disclose to healthcare workers. So if you're in the hospital, in the emergency room, and you have a potential trafficking victim, the goal is don't force them to disclose. You want to provide a safe environment You want to assure them, reassure, reassure, reassure. And one of the things that is used with trauma patients that is also found to be effective with trafficking victims is what's called trauma-informed communication. And basically that's recognizing that there could be trauma, recognizing the impact trauma can have on people, responding with knowledge. You're just going to provide them with knowledge, with reasons, that they don't have to stay in it, with ways to escape, but you're not going to force them to disclose. And also, just understand, victimization and what it feels like to be a victim and how that's going to change their responses to you. And the big thing is to insist on a one-on-one assessment of the patient. Insist on the other person has to go out. It's hospital policy, it's clinic policy, it's whatever policy you want. And then you also want to consider using a forensic nurse or SANE nurse if your hospital or your facility has one to help just assess the patient, document findings, collect evidence, and just, they're trained especially in that evidence collection and in that trauma-informed communications, which is to help the patient along. To screen for possible trafficking victims, there aren't a lot of tools. Like when someone comes into the hospital, you assess their drinking, assess their smoking. There aren't a lot of tools. There is one that was recently completed. It's called the Trafficking Victim Identification Tool. However, it's pretty long. The short version is 5 pages long, and the long version is 9 pages long. So it's really not something that's going to work in an emergency department or clinic type setting. It's something that's going to work when you have more time with a patient, more time to assess them. It's not going to work in ED assessments. There are no quick ED assessments. The biggest things you can ask in an ED type situation: do you feel safe at home? Are you in control of your own money? Do you have any issues with leaving? Things like that. And again, just, are you being held against your will? Can you come and go as you please? How many hours a day do you work? Where do you live? Are there locks on the doors and windows? Those may sound like silly questions, but to someone who's being trafficked, it may be something they didn't think of as being trafficked or wrong, and it may be something that gets them to say, oh wait, yeah, there are problems with that. So let's say that our screen tool worked in the emergency department, or our questions that we asked got the person to say yes, I'm being trafficked, or however they say it, and we help them get out of that life. So that's going to be a long process, but after we do that, there's still going to be some side effects, and that's what I'm going to be going over. So to start off, some common human trafficking conditions that people live in regards to labor trafficking and sex trafficking, they're both going to be subjected to physical and verbal violence, or they're just going to be witnessing it nonstop. For labor trafficking, they're going to have unsafe working conditions. They're not going to have any information on safe practices. They're not going to be provided helmets or sunscreen, that kind of thing. They're probably going to be deprived of their basic needs, such as water, shelter. And then when they do have living conditions, they're probably not going to be the safest. In regards to sex trafficking, they're going to be isolated. They're not going to be with other people. They're going to be constantly living in fear because they're going to be manipulated and controlled by their pimp. And there's also going to be this trauma bond where the person who's assaulting them, they don't want to leave them because they are providing their basic needs, but they are still abusing them. Some physical symptoms attributed to labor trafficking include weight loss, fatigue, headaches, GI symptoms, chest pain, musculoskeletal pain, and dental pain. In regards to mental health regarding labor trafficking, they're going to have symptoms of PTSD, so they might have some triggers in regards to if they were left alone, or if they see a certain thing, they might be triggered by that. They're also going to have symptoms of anxiety and depression. Some physical symptoms of sex trafficking. I read an article, and it was actually pretty interesting. It talked about having a mild traumatic brain injury or a concussion from sex trafficking, from the beatings that they're having, because it's just probably going to be nonstop. Some of the symptoms that they might present with include dizziness, fatigue, and have difficulty concentrating. And then victims of violence also sustain numerous physical injuries, such as fractures to their jaws, eye fractures, might have some strangulations, bruises all over their body. And then there's also a triad of violence injuries, which include PSC, depression, and PTSD. Mental health and sex trafficking is going to be pretty similar to labor trafficking. However, the person that's being sex trafficked is going to be blaming themselves for what they did, feeling guilty for being in the life that they are. They're also going to have depression. They're going to be very fearful. When they're in the emergency department, they're also not going to be maintaining eye contact. So that's going to be a symptom that you would look for as well.
Combating human trafficking, there's several things that we can do to try and combat it. It's learn the red flags that were just discussed, the things to look for when they come into the emergency room. Know your resources, having resources on hand at the time, and just having them available for the patient is always beneficial. Join or start a task force or anti-trafficking coalition. Distribute public awareness. Host an awareness event. Volunteer at an outreach or organize a fundraiser. Just get the word out there. Some current challenges are the healthcare providers are the least represented groups of professionals to address and participate in identifying, assessing, and caring for the trafficked patients. More work and research needs to be done to prevent and combat human trafficking. Supporting services need to be provided. There are some out there, but just not enough for the amount of victims that there are. And then arrests and prosecutions need to be made.
So after a victim has been trafficked, they are going to need many services that the everyday person needs. They're going to need food, so they will be able to go to, hopefully they'll be able to go to soup kitchens, a few faith-based food programs, or any charitable organization. They're also going to need shelter. There are domestic violence and women's shelters, runaway and homeless youth. There are transitional housing programs, undocumented immigrant shelters, faith-based housing, state foster care, state and local housing, community development, and community and development agencies. Much like you and I, they're going to need clothes, so they will be able to go to a Goodwill, Salvation Army, St. Vincent de Paul, any thrift stores, or any local yard sales. They will also need medical treatment, so they can go to a community health center, a migrant health clinic, a city clinic, a free university clinic, healthcare, substance abuse programs, parenting classes, and maternal child health. As we know, some of these victims who have been trafficked may also have legal issues, so they will need aid in form of clinics, agencies, foundations. They can go to law school clinics, pro bono services done by any attorney or immigration clinics. And also being off the street or working in a sex industry or labor industry on against their will, they might not have your basic job training. The Goodwill Career One Stop both offer vocational training and employment assistance programs. They will need education services. Some of them might need help finishing their GED, adult education services, immigrant community organizations, and also with this being a big immigrant field, they could need ESL or interpreting services. They will need transportation getting to and from these different services. So public transportation will be provided for low fares. Hopefully they can get aid in the form of a car, get bike donation services, voluntary driver programs, and additional services that they might possibly need are battered immigrant women's programs, sexual assault coalition, a right crisis center, and an ethnic community organization. The National Human Trafficking Resource Center is one of the big national databases that kind of overviews human trafficking. They have a bunch of just statistics and facts if anyone wants to learn more. And here's the report line is the 1-800 number. And you can also, they also have a text if you need it. They are open 24/7. They offer English and Spanish and 200 other languages if you do not speak the home language of English, and there's a website for more resources. We've also added a couple local resources right in the Metro Detroit area. The Michigan Abolitionist Project, All Worthy of Love, Vista Maria, and the Human Trafficking Clinical Program that the University of Michigan Law School offers.
All right, and as we finish up here, Super Bowl Sunday is coming up in a couple months. So you might think, what does Super Bowl Sunday have to do with human trafficking? Well, this is just going to kind of give you a different outlook. We hope you enjoyed our presentation. We hope you learned some things. If you need more resources, we hope we've provided that to you. Thank you.
you.